Good afternoon, everybody. Wynn Brown with Heywood Healthcare's update for Friday, March 25th. Happy to give you a report on what's going on at Heywood Healthcare. Just on our COVID-19 testing, which I always start out on, I don't have any updates on our own testings in time for publication tonight, but the numbers have improved dramatically. At the peak of the pandemic, I would get 20 pages of positivity, and we are typically running at 1 or less. Our community average is 8 per 100,000. So the service area that we have is somewhere between 85 and 100,000. So that is very good for us. And the state is at 9.7 per 100,000. So we are ahead of the state right now. We have 4 COVID positive inpatients at Heywood Healthcare right now. Just an update for folks at Heywood. We've been following up on our employee engagement survey, which we finished up in the end of December, which then translated to us getting the data middle-ish of January. President's Advisory Council has reviewed all of that. We met this week. Jamie Ledger's helping lead that with the team. We have about 25 members of the President's Advisory Council. And they have broken down into 3 what we call tiger teams. Ironically, you might see that Joe Biden is using that same term, but we've been using it before him as we look at what we're going to be doing. And so the 3 areas of focus that we are going to be looking at with our tiger teams are recruitment, retention, benefits, and staff appreciation. Recruitment, retention, benefits, staff appreciation, and wellness, and local communication changes. And when we look at local communication, the feeling is that sort of senior leadership, the kind of things I do and the senior team do are pretty well hardwired, but how that cascades down and gets delivered from our leadership team across the organization directly to staff, we need to do a lot of work on. And so those are what the 3 tiger teams are going to be working on. You'll see that work product coming out. And at the same time, all the senior leaders are working with their direct reports, their directors and managers to work on department-specific opportunities as well that come out of that. And the tiger teams will be meeting bi-weekly. So we're very excited about some of the things that we already know are going to be coming out of it from our early conversations, but stay tuned. We have not forgotten about what you told us and what you said to us, and you're going to see some recommendations and action planning coming out quickly. I also just want to say something about cybersecurity. We're always focused on cybersecurity. We have all sorts of things that happen in IT, but really staff are the front line for us on many things. And with all that's going on in Ukraine, and you've probably seen on the news, the concerns about cybersecurity attacks with Russia, obviously healthcare is one of those vulnerable areas, and we need to pay attention to that. So I appreciate if you just be aware that there are phishing attacks and all sorts of things that go on every day. You have no idea what our technology infrastructure catches before it could even get to you. But just some reminders from our IT team to everybody at Heywood. Look for red flags associated with phishing emails, such as a suspicious sender email and their addresses, or a sense of urgency. You know, sometimes you'll see something come through in like 1 letter's different in the email or the topic. Be very careful of emails that from legitimate senders with links or attachments that you may not be expecting. And if you do not normally receive requests for files or other information from a sender, please call the individual to confirm that's what they want or need, just to make sure it's legitimate. You can also always call the help desk if you have a question, and never put your network credentials in anything other than our system. So just some flags, and let the help desk know if you see anything in particular. And they get calls every day, and that is fantastic, and that's what they're there for, to help triage those things. And that extension, as most of you know, is 6211. Some updates on the surgical pavilion. We talked a little bit about this last week, and there's some pictures embedded here. Not necessarily the surgical pavilion project, but the energy project. We had 3 new air handlers dropped in behind the hospital on new pads about the size of an 18-wheeler, the back of an 18-wheeler, pretty fantastic. But that will support the surgical pavilion as well. Obviously, we have blasting going on 2 times a day, sometimes 3 times a day. We'll overhead page prior to that. And outside the hospital, we have 3 longhorns for 5 minutes before, 2 shorthorns for 1 minute, and then 1 all clear after the fact. So please pay attention to that and be aware. And also, if you're working with patients, make sure that they're aware of it too, if they might hear it. I heard it yesterday. think it was yesterday. And it was just a little, okay, something happened. But we just want people to be aware. The big change for us, as I think all of you know, if you've been reading your emails and looking at the time clock information, is starting Monday. We are changing our parking pattern. The south lot will no longer be accessible to any parking. We have satellite parking running to Mount Wachusett, and we are going to have as many people park off campus, either at Mount Wachusett, on Green Street, or on Matthews Street, or in our other parking lots, so we have room for one patients and second and third shift on our campus as well on the north side lot. And so we have 2 shuttles running Monday through Friday, 6 a.m. to 9 a.m., 2 to 6, and then 1 shuttle running in between that time. And if you have any issues in between that, you can talk to security. We also listened to you. We heard that you were concerned that 6 p.m. wasn't enough, so we've added a shuttle from 6 to 8 p.m. to get to Mount Wachusett as well. And we're going to continue to reevaluate as we have to settle in, all of us have to settle into a new rhythm of how we arrive to work and where we park. So I appreciate everybody paying attention to that, taking responsibility, knowing it might take a little more time. Think of it as like it's going to snow and I got to get to work a little bit early. That's what we need to think about. There's a map here embedded in the email that's coming to you as well. Just some kudos going out to Gardner Square 2. They had their annual meeting, their annual leadership meeting on the 23rd at the Ale House, and they do great work in our downtown area. And then to our west, our friends in Athol, Brianna Drowan and Sean Sahowski led the founding and startup of, she started it, he was there, let me get that straight, of Launch Space, and that is to celebrate the transformation of Athol's Pleasant Street School into a commercial kitchen to increase healthy food access and to strengthen workforce and economic development in the North Quabbin region. And as you know, we are very much into food security and making sure that there's adequate food and healthy food in our region. And so we applaud that work that goes in parallel and partnership to what we're doing. There's more. Booster requirement. No, we have a handful of staff who have not gotten their booster on time. Your managers will be meeting with you individually to talk about your timeline to get that done, so we can do that in partnership and not be punitive about it, but we need to get it done. And we all need to take control of doing what we need to do in that area. So either get yourself scheduled. If you have some issues or concerns, talk to your manager or your director. And then there's some save the dates embedded here for our golf tournaments, our Heywood Shuffle, the Relay for Life, and our Healthy Harvest 5K. As we head into what's going to be, I hope, a nice spring weekend. I've got some cleanup things I'm going to be doing around the house, and I'm sure some of you are thinking of that as well, as we continue our journey to be one of the best community health systems in America. Take care, everybody.